thank you, Professor Carraro, for inviting me. And I present you a trial that we made in our rehabilitation center in Fondazione Borghi. And the global pandemic of coronavirus 2019 has revealed a lot of extra pulmonary manifestation, and 15% of patients in ICU, recovered in ICU, presented clinical illness polyneuropathies, primarily due to the infection and also from the immobilization in ICU as well. And living from pulmonary problem, and we see an impairment of inspiratory and expiratory muscle, but also a weakness of total body and the huge loss of muscle on total body. And the literature suggests that electrostimulation can help this type of patient, can help to restore the muscle and prevent the muscle weakness. But the parameters used that we can see in the literature are parameters of 30 till 50 hertz in frequency, and the impulse of 250 and 400 microseconds. And as we can see, a muscle contraction. But we use this impulse program, but it doesn't work with the post-COVID patient because the muscles were very, very weak, and it was very difficult to reach a good contraction. So we decided, as you can see, the patient is unable even to get the sitting position. And the patient now is better because he's in a rehabilitation center, and the patient is very, very weak. And so those parameters, we didn't reach a good contraction. And so we try to enhance stimulation till 130 milliampere of intensity to get a good contraction. But you know, at this intensity, high intensity, is impossible to reach tetanization. And so because at 30-40 hertz of intensity of frequency, it hurts. And so we use this program, this intensity, high intensity and less and low frequency treatment for our patient. And so we see some result. We saw the muscle activity increase. And then we decided to study in 10 patients admitted in ICU, and we stimulated upper limb with this type of stimulation. We stimulated the triceps and the extensor wrist muscle, and the lower limb quadriceps and anti-gravitary muscle. And we stimulated also intrinsic muscle of the hand and intrinsic muscle and the dorsiflexor muscle of the foot. And so we compared the three different type of stimulation. And we detected the contraction with the electrostimulation biofeedback device. And those are the results. So at the beginning, only the impulse 1 hertz could provide a contraction, and 1 hertz till 80 till 130 milliampere of intensity could provide a contraction. But after 2 months, even the normal tetanizing impulse, 30-40 hertz, could provide a contraction, and tetanization of muscle was restored after 2 months of stimulation. And so, as you can see, the patient finally could reach a standing position with the help of stimulation. And what about the intrinsic muscle of the hand and the dorsiflexor of ankle? Here we saw a huge denervation, and even our impulse in 1 hertz didn't provide any contraction. And so The only impulse that works in this case was a classic triangular impulse that provided a contraction for the intrinsic muscle of the hand and the dorsiflexor ankle foot muscle. And after 2 months, the same situation, because we observe a real denervation pattern of those muscles. And in conclusion, I am a physiotherapist, and I like to use electrostimulation for our patient. And in this case, a post-COVID patient was a real challenge for us, because at the beginning, patient is very awake and he couldn't move anything. And with the electrostimulation, the patient were helped, and it was a real defibrillator for to recover muscle function in severe week-long COVID patient. And after 1 year, normally patient could restore a normal function activity. Thank you very much for your attention.